I want to talk a little bit about chronic kidney disease very quickly in the news. And the reason for this is what do you know about chronic kidney disease, producer Dave? Anything?
No.
I'm going to give you a few facts on chronic kidney disease, okay? Causes more deaths each year than breast cancer or prostate cancer. Under-recognized as a public health crisis. This is from the National Kidney Association. 35.5 million adults are estimated to have chronic kidney disease. That's 1 in 7 people. 1 in 3 adults at risk for it. Do you know what some of the biggest risk factors for chronic kidney disease are?
Drinking? No.
How about hypertension?
Oh, okay.
Something that like 30% of us have. Diabetes. 1 in 3 adults with diabetes, 1 in 5 adults with high blood pressure have chronic kidney disease. Diabetes is considered the most common cause of chronic kidney disease, and most cases of chronic kidney disease are actually caused by either diabetes or hypertension.
I take it untreated hypertension, right?
Untreated hypertension. Okay. So the better, that's why it's important to see your doctor if you're diabetic, have high blood pressure, or exercise.
I have high blood pressure, but it's under control.
It makes a big difference. Yeah. It's just a fluid pressure pushing on the arteries and how that affects everything. So if you control your blood pressure, that makes a big difference. But everyone that has chronic kidney disease out there, this is what I kind of want to get to, because I just think this is an important public health message. There's 2 tests that you really need to get at least once a year, if not twice a year. One is a metabolic panel to test for your renal function to make sure your kidneys aren't advancing too big. So when you go to see your doctor, make sure they're testing that. And then number 2 is urine, protein in your urine. And this is really important, because one of the things we're starting to see in our studies is that people with chronic kidney disease that have protein in their urine, they have a lot higher rates of death and a lot higher rates of heart disease. So how that correlates, how this ends up relating to this is a complex physiologic thing. But if you have protein in your urine, it's something that you should really know about if you have kidney disease. And I have to say, it's treatable. There are drugs now that can treat it, and that makes a big difference. So really important to have this conversation with your doctor.